Services.
By now, these
Station
newborns were
18,
supposed
the
to be at
Bronx.
home in their
At the
nursery.
peak of the COVID-19
Instead,
pandemic,
they're
one of
stranded
the
in a
busiest
facility
call
run by a
centers in New York
reproduction
City.
clinic in Ukraine. They were born to
Ambulance
surrogate
crews
mothers
saw
for
their daily
foreigners,
call volume
but
more
with the
than
country's
double.
closed
The number
borders,
of
the parents
cardiac
can't
arrests
travel to meet them,
skyrocketed, along
and
with their
nurses
stress
are now
levels.
looking after them.
Anthony Almagera recalls responding to 13
Parental care
cardiac
cannot be
arrests
replaced
over
with
the course of
anything
a
else,
16-hour
no matter how
double shift.
professionally a person looks
You're
after
going
babies.
into the fray,
The
doing
psychological
all
and
your
emotional
protocols
connection
and
must be
everything you
established
can,
within the
intimating
first
people.
days of the
You
baby's
think you
life.
should be able to get them
We
back,
tried to
and
send
you're not.
parents photographs of the children.
Emergency Medical Services, Station 18, the Bronx. At the peak of the COVID-19 pandemic, one of the busiest call centers in New York City. Ambulance crews saw their daily call volume more than double, and the number of cardiac arrests skyrocket, along with their stress levels. Anthony Almagera recalls responding to 13 cardiac arrests over the course of a 16-hour double shift.
You're going into the fray, doing all your protocols and everything you can, intubating people. You think you should be able to get them back, and you're not. Wait, this person was just talking to me. Why are they dying?
Almagera says the strain has taken a toll on him and his colleagues, most of whom have much less than his 17 years of experience. The average age of a New York EMT, just 25.
It's a very young workforce with very low experience. And that's dangerous. It threatens lives.
The union argues that low pay and high stress have led to high turnover and a less experienced workforce.
The people of the city are literally dying because of the lack of experience and the retention problem that EMS has.
EMTs are a part of the New York City Fire Department, but they don't receive similar pay or benefits to other first responders. In fact, they make tens of thousands of dollars a year less than firefighters, police officers, and sanitation workers with similar levels of experience.
While the mayor has heralded the work of EMTs and called for federal assistance to help frontline workers,
$200 billion nationally to establish hazard pay for essential workers and their survivors.
the city does not formally recognize EMTs as a uniformed emergency service. They've been working without a contract for more than a year.
We go into dangerous situations all day long, shootings, stabbings, what have you, and now we're going into situations where we still respond to all those calls, and everybody is a potential COVID patient. So it's fighting a war against an invisible bullet.
He worries that strain has and will continue to cost lives in the department as well as the community it serves.
By now, these newborns were supposed to be at home in their nursery. Instead, they're stranded in a facility run by a reproduction clinic in Ukraine. They were born to surrogate mothers for foreigners, but with the country's closed borders, the parents can't travel to meet them, and nurses are now looking after them.
Parental care cannot be replaced with anything else, no matter how professionally a person looks after babies. The psychological and emotional connection must be established within the first days of a baby's life. We try to send parents photographs of their children and organize conference calls, but this cannot substitute direct contact.
The issue was raised when the owner of this reproduction center in Kiev released a video showing dozens of babies waiting for their parents. It's estimated that across Ukraine, nearly 100 infants are in the same situation. If borders remain closed and lockdown measures are extended, many fear the number could quickly rise.
These children here are facing a big problem. They can't go to their parents, who are in China, France, Spain, Italy, the US and Bulgaria. They're all in the same situation because the borders are closed.
Ukraine is one of the few countries that legally allows surrogacy for foreigners. With a weak economy, many women turn to the controversial industry, where they can earn about $15,000 for each pregnancy. The Foreign Ministry is now trying to find a way to allow parents to travel to Ukraine to pick up their infants.
We have some parents who are 50 to 55 years of age. They've been waiting for this child for 20 years, and they were given this opportunity.
For the parents of these newborns, a journey years in the making will have to wait